Hello and welcome to our latest Pediatric MS Navigating Your Journey program. My name is Krista Harding, and I'm a senior manager in the community engagement team at the National MS Society. As we get started today, we want to remind you that the Society's mission is to cure MS while empowering people affected by MS to live their best lives. We also want everyone to feel comfortable coming to the National MS Society for support. For that reason, we share our inclusion, diversity, equity, and accessibility statement at the top of our program. We amplify the voices of all people affected by MS and celebrate our differences in the drive to end MS. We affirm the space for everyone to express their perspectives, fueling our vision with innovative ideas and insights. We commit to advancing inclusion, diversity, equity, and accessibility within our workforce and across the MS movement. So, for those of you who are joining us for the first time, we start each of these programs with a brief overview of pediatric MS. Before you or your child were diagnosed with MS, you may not have known anyone with MS, or you may not have even heard of it before. We learned from a study published in 2019 that nearly 1 million people live with MS in the US, and there are 2.8 million people worldwide living with it. It's estimated that fewer than 5,000 children and teens live with MS in the US, and fewer than 10,000 teens live with MS worldwide. So, what exactly is MS? MS is a disease of the nervous system, which includes your brain, the spinal cord on your back, and your optic nerves, which connect your eyes to your brain. In MS, the body accidentally attacks normal cells called myelin, and when that's damaged, it's difficult for nerve cells to send and receive information to and from the brain. One way to imagine this is to think about when a phone charging cord gets damaged. If the outside coating isn't doing its job, the wires underneath might not work as they should, and charging could become slower. So, like the charging cord, damage to myelin may slow down the messages your brain is sending to the rest of your body. These attacks produce something called lesions, which can cause symptoms in MS. We don't know yet what causes MS, but researchers are working hard to figure it out. We do know that women are 3 times more likely to have MS than men, and that MS is more common the further away you get from the equator. We know that you don't get MS directly from your parents, but that some of your DNA, called genes, may make you more likely to get MS. In fact, if someone's mother or father has MS, their chance of getting it themselves is just 1.5%. And if their sibling has it, the chance of getting it themselves is 2.7%. Having low vitamin D levels, being overweight as a kid, smoking or living with someone who smokes, or having been sick with mono could also make you more likely to have MS. However, it's important to know that there is nothing you or your parents did that caused you to get MS. Scientists believe that getting MS is caused by a combination of factors, and many of them are completely out of your control. There are 4 types of MS, but for young people, relapsing remitting MS is the most common. People with relapsing remitting MS often feel fine, but then have periods when their symptoms last for more than a day and feel much stronger. Those periods are called relapses, but some people call them exacerbations, attacks, or flare-ups. All these words mean the same thing. It makes your MS feel worse. Even though relapses last longer than a day, you will feel better once they end. Most young people recover well from relapses, and relapses don't necessarily cause permanent change. There's nothing you did wrong that made you have a relapse, and some medicines can help you manage them. MS can make your body feel strange, and everyone's experience with MS is different. Sometimes your vision might become blurry, your hands might tingle, or your foot feels numb for a while. Some of you might feel really tired every day, or like you can't focus at school, and others might feel sad or worry or be in a bad mood a lot. Maybe you feel a couple of these together, and maybe there's symptoms that come and go. All of this is normal with MS. There are things you can do to help your body feel good, like eating nutritious foods and being active. And even though we don't yet have a cure for MS, there are medicines you can take to help, both for your body and for your mind. To treat your MS, your doctor might prescribe a disease-modifying therapy. The goal of these medications is to prevent MS from getting worse by preventing new damage. Those lesions we talked about earlier from being formed. The medicine might not make someone feel better, and because of that, they might not want to take it sometimes. But it's constantly working inside their body to help stop them from having new changes or relapses in the future. They may not even notice that it's doing its job, but it is. MS medicine will work the best when someone starts taking it as soon as they find out they have MS and continues to take it regularly as prescribed by their doctor. Because everyone's MS is different, medicines work differently for each person too. So your doctors might want to try out a few different kinds right away or in the future. No matter which one you choose, the best medicine for you is one that you, your parents, and your doctors decide is the right fit to help you feel as good as possible. If you are a young person living with MS, I want you to know that the way you feel about your MS treatment matters. Your doctors want to know how you're feeling and to hear about your experience with your MS medicines. Your opinions matter, and I would encourage you to be an active part of your own care team. And now let's meet our presenter. Nick Brenton is a pediatric neuroimmunologist at the University of Virginia in Charlottesville, Virginia. He specializes in the diagnosis and treatment of neuroimmune disorders, including MS, in children. He created and directs UVA's Pediatric MS Clinic and performs collaborative clinical research within the field. His research has primarily focused on environmental influences on the risk for and course of pediatric MS. He also studies outcome metrics that predict future disability in children with MS. Welcome, Dr. Brenton.
Thanks, Krista. It's great to be here. All right, everyone. I'm excited to be here to talk a little bit about topics that go kind of beyond medicine. So as Krista mentioned, with your neurologist, with your doctor, you're going to pick out something called a disease-modifying therapy, hopefully that is going to help keep MS stable and from acting up again. We're going to talk a little bit about beyond that decision. So once you've made that decision, okay, we're going to put that aside and we're going to think about all of these other things that you can do as a child or young adult living with MS or as a parent of somebody who's young with MS to kind of maximize your experience in living with this chronic disease. We'll touch on diet, exercise, and wellness in pediatric MS today. So kind of what to expect from this little talk that I'm going to give is we'll focus a little bit in the first part of the talk about how the treatment of MS is more than just whatever medicine you pick with your doctor. There's so many other aspects to this, including the symptomatic management of MS fatigue and depression and anxiety, cognition, academics, and the psychosocial aspects of living with a chronic disease. We'll spend the second half talking a little bit about lifestyle factors, such as diet, weight, and exercise, physical activity levels. And then finally, I'll have a last slide to kind of talk about the concept of wellness that I try to bring out with my patients to talk about how we can really get young people with MS to thrive despite having received this diagnosis. So you may think that when you meet with your neurologist, who is your pediatric MS doctor, that we're only thinking about MS in terms of the MRI and maybe the weakness or the numbness or the vision issues that that MS has caused. But in reality, as doctors, we're thinking about a lot more than just the core symptoms of MS or the things that brought you to the neurologist in the first place. We're thinking about the psychological aspects of being a young person living with this disease. We're thinking about the connection that you're making with your family, with other kids your age who don't have MS. We're thinking about how you are doing in your academics, how you're thriving in your scholastic achievements, what your future career will be, if you've changed those plans or if you've kept the same plans, how you're feeling, the fatigue that you may experience on a daily basis, any pain that may have occurred as a result of MS. This whole picture is something that we should try to focus on and can be difficult to focus on the whole picture in the time you have to spend with your neurologist. But really, we want to start thinking comprehensively about pediatric MS as a whole. And when we talk about managing MS, it's not just picking that disease-modifying therapy, but it's also thinking about ways that we, as doctors, can support your day-to-day experience of living with MS. And that includes maximizing your functionality, your independence. You're a teenager, most likely, getting ready to go off to college or start a job or start your life separate from your parents. So learning how to be independent and to manage yourself. and also you're learning about this disease moving forward and ultimately, hopefully, improving your overall quality of life. It's also important, and many of you probably recognize this, that the care of a young person with MS is not just the neurologist. There are a lot of other people that come into play, and it's facilitated by your MS team. And I've listed a bunch of roles there that you may or may not recognize because some of these people may not be involved particularly in your care. But many of you may recognize some of these roles. Beyond the neurologist, you've got your primary care doctor, you've got a neuropsychologist who may do some cognitive testing. You have an MS pharmacist potentially, physical or occupational therapist, psychology, psychiatry, dietitian, nutritionist, and then many other specialists that could be involved, like an eye doctor or an ophthalmologist, that may play roles specifically in the management of your MS. One of the first things we're going to talk about in terms of the symptomatic management of MS is probably one of, if not the most common symptom that I hear my patients describe is fatigue. And many of you young people with MS who are listening to this may sympathize with a lot of the ways that fatigue has been described by prior young people with MS. It's been described as feeling like you're missing out on life, looking through a haze, like you're wearing a giant sandbag, or as one patient says, I'm just so tired that when the teacher speaks, it goes in one ear and out the other. So fatigue secondary to MS is often this overwhelming sense of tiredness, this lack of energy, feeling like you're dragging through the day. And it's a very common complaint in young people and adults with MS. It can be associated with lower academic performance, impaired social interactions, and overall reduced quality of life, especially if fatigue levels are high. It's important to recognize that fatigue in MS is multifactorial, meaning there's not usually one single identified aspect that's causing it, right? It could be poor sleep. It could be a mood disorder like depression that's making you feel more tired, or it could be completely unexplained and we don't know, but we associate it with MS. But there are lots of treatment possibilities for fatigue. And so I don't want you thinking that you have to live like this forever. Sometimes it's very simple where you look for the causes or the triggers and you try to fix the things that you can. So maybe it's the fact that you're not falling asleep until 2 a.m. because you're up on your phone and then you're just feeling tired the rest of the day. Well, that's fixable. It may not be a desirable fix. You may not want to get off your phone at 10 o'clock at night and lay down in a dark room, but that's something that could be fixable. But there may not be triggers. There may not be obvious triggers. Maybe you're sleeping perfectly. Maybe you're eating perfectly. Maybe you're being physically active, and we have to be a little bit more creative. As I mentioned, exercise, having a higher physical activity level can lower fatigue over time. Eating healthy foods, which we'll talk about a little bit later, can also have positive impacts on the symptoms of fatigue. And then ultimately, in my mind, as a pediatric neurologist who treats children with MS, medications are kind of my last resort. And I've listed a couple there that are common medicines that sometimes can be used to treat fatigue, but usually I reserve these medicines for when the fatigue is interfering with the daily functioning and can't be addressed by those things that I've already mentioned. Pain is something that's less commonly seen, but still something that happens in young people with MS. Pain can be multiple different types. And so, as a neurologist, it's really our job to kind of tease out what the pain is. But two of the more common types of pain that I see in the pediatric MS clinic is spasticity or tightness. This can be like a muscle spasm that can occur in your calves, your legs, or your arms, and can be painful, particularly if it happens at times where you're not expecting it or you're busy doing something else. And so there are lots of treatment options for those, which can be therapy with physical or occupational therapy, physiotherapy, and then there's other medication options there that are listed. These medicines are good in the short term. I use them when I need to, particularly if it's bothersome to the patient, but I try not to think of these medicines as forever medicines, but as medicines to get you through those painful periods of time as your body kind of fixes itself from that MS attack that this may have resulted from. Neuropathic pain is another type of pain that is often described as like a burning sensation or a pins and needles sensation that can be in your arms, your legs, and typically, like spasticity or tightness, can be noted following a relapse and during that recovery period. This is also something that sometimes people have, and it's annoying, and they can work through it, and it gradually gets better over time. But certainly, if it's limiting your activities or causing a large amount of uncomfortability, then there are a lot of medicines that can be used to treat that. Much like the spasticity medicines, the medicines that manage neuropathic pain are good in the short term. And almost every one of my patients, I'm able to get these off of after a period of treatment because they can have some side effects, predominantly sedation or sleepiness, that make us not want to have to use them in the long term if possible. One of the other aspects that's really important in pediatric MS is cognition. And so this is how we think, how we remember, how we pay attention, how we focus. Up to a third of kids may experience issues at some point with this. Most commonly, the things that we see are processing speed difficulties. So the time it takes for a teacher to ask you a question, for your brain to process what they're asking, for your brain to think about what the answer is, and then put out a response may take longer on average than somebody who doesn't have MS that's your age. Memory can be affected, and also the ability to focus or the attention levels can be impacted in pediatric MS patients. People at the highest risk for this tend to be the ones who have earlier onset of MS, have a higher amount of lesions from MS in their brain, and also the ones that are most affected physically or externally from MS seem to be the ones at highest risk for these cognitive issues. What can we do? This isn't the practice for everyone, but what I do with my patients is I try to get them evaluated by a neuropsychologist, so somebody who is qualified to administer cognitive testing to see how they perform, so we can identify any areas of weaknesses at the time of diagnosis and intervene in those types of things if we need. It also serves as kind of what I call an insurance policy, so that maybe you feel good now, but 10, 20 years down the line, if you start having cognitive issues or complaints or concerns, then we have testing from way back when you were diagnosed to kind of refer back to if we need to. Also, we can do assessments of scholastic achievement through the school, and then the school, in conjunction with us as your neurologist and also the neuropsychologist, can create a plan for school so that we can overcome some of the difficulties if there are those. So I always joke with my patients, I don't have a pill to fix attention problems or processing speed issues, but we can make accommodations in school to help with those. And so, for example, for attention issues, it may be sitting you at the front of the classroom instead of back at the back of the classroom next to a window where you're more likely to be distracted. For processing speed issues, it may be that we give you longer time to take tests than the average student because it takes you longer to process the information. It doesn't mean you're any less smart than the average student, but it just means that you may need a little bit more time to get the right answer as compared to a student who doesn't have MS. One of the biggest things that impacts young people with MS is mood and your functioning in a psychosocial capacity. In general, pediatric MS patients have a higher risk for anxiety, attention deficit disorders, and also depression. And I usually tell my patients, in my experience in all my years of doing this, virtually every single one of my patients at some point struggles with one of these aspects as they live with MS. And most of them, it's usually early on in the disease course, especially as they get to know their body and this disease. But it is a very common and shared experience among any young person living with a chronic disease like MS. And there are lots of treatment considerations for this, and this includes first and foremost talking to your neurologist, your primary doctor, about your feelings and what you're experiencing. This may include a referral to a counselor or psychologist or a psychiatrist. This may include a discussion about your physical activity levels. As we discussed earlier with fatigue, being physically active, eating a healthy diet can also have very positive benefits on your mood. Connecting with other people who've been through this before. In our program, we connect patients who are recently diagnosed with patients who've been living with pediatric MS for a longer period of time. And so those parents and those patients have somebody who's been through what they've been through before. And then also with programs like today, the National MS Society programming is there to help connect you to others and to resources that you may need. And then ultimately, again, like with most things, medications, I don't typically consider a first line, but they are an option and they are very helpful when they are needed. So now I'm going to step into the second part of the talk, which is we're going to really discuss a little bit more about, again, you've made that decision about your disease modifying therapy with your neurologist, but what other therapies or other treatments can we do in addition to the medicine that you've already picked to manage your MS? So Krista already mentioned this, but vitamin D is a very important vitamin that helps build our bones strong, but it also is very important for supporting our immune health. We know that low vitamin D levels increase your risk for getting MS. And we also have more evidence recently, which I'll talk about on the next slide, that the vitamin D levels may impact your MS the course of MS. So where do we get vitamin D? We get vitamin D from the sun. So the sun is our primary source of vitamin D and is something that I advocate my patients get good exposure to because this is the most natural way to get your vitamin D levels up. It partly depends on the season. So if it's mid of winter, you're not going to get as much sun exposure, obviously, as you would in the summertime. Also depends on how much you are outside. We'll talk about this a little bit in the physical activity section where promoting your health by being outside and getting that sunshine, but also getting the physical activity is really important. How exposed your skin is. It doesn't matter if it's the middle of summer, but if you go out with long sleeves and long pants and a hat on, you're not going to get much skin exposure to the sun, and that's what's critical for getting your vitamin D levels up. And then your pigmentation of your skin may also play a role in this. So darker skinned people require more sun exposure to get the same amount of vitamin D as lighter skinned people do. A lot of my patients joke about how they can change their diet to enhance their vitamin D levels. And in reality, the food content of vitamin D is actually fairly minimal compared to the sun exposure. So your biggest chance of raising your vitamin D levels is through the sun. However, fortified milks and cereals can be helpful in terms of giving vitamin D, but then also I joke about fishy fish like salmon, mackerel, sardines. They're really the fishy tasting fish are the ones that are probably the best dietary source for vitamin D. There have been lots of clinical trials in adults with MS looking at if vitamin D, once you've been diagnosed with MS, really makes a difference. And I don't want to go through all of these studies just to show you that there have been a lot that has been done on this topic. And in general, if you look at all of these different studies, including the very last one, which just came out a couple months ago, vitamin D actually does appear to have a beneficial effect even after you've been diagnosed with multiple sclerosis, particularly on outcomes on the MRI. So in terms of how many lesions you have or the development of new lesions. People with MS who have good vitamin D levels appear to have a lower likelihood of having more lesions on their MRIs over time. In kids, this has been looked at too. We know that low vitamin D levels are associated with a higher risk for a relapse from MS, a higher likelihood of having more lesions on your MRI, and then a higher likelihood of having disability in the future if your vitamin D levels are low. So ultimately, what I want you to take away from this is outside of that disease-modifying therapy, vitamin D can be helpful in addition to that. So vitamin D is more likely helpful than harmful in kids with MS, and I would encourage you to talk about having your vitamin D level checked with your neurologist or your primary care doctor, and then based off of that level or based off of their expertise, they can give you a dose of vitamin D to take, and they can also give you a frequency with which to take it. In addition to that vitamin D supplement that you probably will be taking, the daily sun exposure can only help that level and is a good thing. And then over time, your neurologist, your primary care doctor can monitor your vitamin D levels to make sure they're not too high and not too low. One of the things that we have a lot of evidence about from the adult world is that smoking cigarettes has a very negative influence on MS in general. It increases the severity of MS and it increases the risk for MS progressing over time if you are a smoker and you have MS. So many of my patients are too young. They haven't even thought about smoking, so they don't smoke themselves. But something else we have to worry about is secondhand smoking. And that's parents smoking in the house or relatives smoking around our pediatric MS patients. And that can be just as negative, have just as negative effect as smoking yourself. And so I tell my patients who smoke and then also the parents who smoke that there's never a better time to think about quitting smoking than when your child has been diagnosed with multiple sclerosis. So for my MS patients, if they smoke, they need to figure out how to quit. If they are not smoking, they should never smoke. And then if there's anybody in the family around them who's smoking, then there's never been a better time to think about quitting. Talking to your primary care doctor about what options exist. Usually cold turkey isn't the best way to do it, and there's lots of different types of treatments to help you wean off of that smoking to help enhance your quality of life and lower your risk for progression with MS. Obesity is something that has been mentioned as well before. And obesity at the time of diagnosis is associated with an increased risk of MS in children. And this appears to be what we call a dose-dependent relationship, meaning the more obese or the heavier you are, the higher the risk is for MS. One of the studies that we looked at earlier is we knew that MS, obesity at the time of diagnosis was a risk factor, but we didn't know about what kids with MS look like way before their diagnosis. Is obesity something that happens around the time of diagnosis because kids just don't feel as well with their MS and aren't as up and moving as much because of fatigue, pain, and all of those other types of things? And what we found is the answer is actually no. And what you can see with that vertical black line is that's the time of clinical diagnosis of MS. On the far left, we have body mass index, so your BMI, which takes into account your weight and your height. And you can see the red line is our pediatric MS patients, and the blue line is kids without MS. And you can see that their body mass index is much higher in the pediatric MS patients, and it becomes higher roughly 10 years prior to their first symptom of MS. If you look at the middle one, that's their weight. Their weight, similar to their BMI, is very high, and on the far right is their height. So heights are similar. It's the weight that's the big difference. And weight is not something that just rapidly increases at the time of MS diagnosis. This is something that kids have lived with for up to 10 years prior to the MS diagnosis. So it really does precede the clinical onset of MS and is indeed a risk factor for the disease. But what about how obesity impacts MS once you have it? We know less about this, and there are a lot of people who are looking at this right now. There's been work in the adult world showing that if you are obese or overweight and you have MS, you have a higher odds of having more severe disability later on in life. You have higher evidence of inflammation within your spinal fluid and your blood. And then overall, you have more of a profound effect on your brain MRI if you are obese living with MS. But what about kids with MS? So we don't know the answer to this yet. There's been a lot of research that's ongoing, including a study that we are doing here, looking at body composition. So how much of your body is fat tissue, how much of it is muscle, and how healthy your bones are. And we are looking at children with MS and children without MS, and looking at how obesity or being overweight and having high levels of body fat may contribute to how severe your MS is early on in the course by looking at your MRI, by looking at markers in your blood, and also by looking and asking our kids with MS how they feel and function. So hopefully one day I'll come back and give you information on this study once we have the results determined. What about diet in MS? So this links directly with weight. We know that making smart choices in your diet can have multiple benefits, not just for kids with MS, but for kids in general. We know that having a healthy diet reduces the chance of obesity, helps you to maintain a healthy weight. We also know that there's potential positive influences on MS, which we can talk about in just a second, and then also positive influences on common things that run with MS, like fatigue, depression, and anxiety. Many researchers are thinking of diet as being a potentially adjunctive therapy or an additional therapy that is added to your disease modifying therapy that you decided about with your neurologist. Because many of the things that we consume in our diet may influence overall our immune system. So we know that the digestive system interfaces directly with our immune system. And so the things that we consume that pass through our gut are going to have direct effects on the immune system. We know that once those products are broken down and released into our bloodstream, that also can interact with our immune system. And we also know that what we eat helps determine and build up those energy producing parts of our cells. And so, smart diets or healthy diets are more likely to enhance the energy producing parts of our cells, which is critical for somebody living with MS. So, from research that's been done in adults, we know that higher quality diets, and when I say a higher quality diet, I mean a diet that's higher in fruits, vegetables, legumes, whole grains, and is generally lower in added sugars, processed foods, and red meats. People who have high quality diets have lower levels of disability, and higher quality diets are linked with lower levels of fatigue, depression, pain, and also cognitive issues. So, all the things that we talked about in the prior slides. We know that diet and pediatric MS may also show an association with clinical outcomes. And so, from a very large studies looking at kids with MS at the time of diagnosis, we know that kids who consume a lot of energy from fats, particularly saturated fats, have a higher risk for relapse as compared to those kids who get more of their energy intake from fruits or vegetables. They have a lower risk of relapse overall. There have been a lot of diets, popularized, fad, mainstream diets that have been looked at in multiple sclerosis research. And I've listed several of them here, and to go through them briefly, swank diet, which is a low-fat diet, the Paleolithic diet, which is consuming non-domesticated meats, vegetables, fruits, legumes, and avoiding processed foods, dairy, eggs, and gluten. The McDougall diet, which is a plant-based diet, Mediterranean plant-based, but also with encouraging whole grains, veggies, legumes, fruits, nuts and seeds, herbs and spices. Intermittent fasting, which is where you can eat at certain times or certain days and not eat at other times. And then the ketogenic diet, which has been a diet that's been helpful for patients who live with seizures or epilepsy, is a very high fat, low carbohydrate diet. All of these diets have been looked at in MS in one way, shape, or form and are continuing to be looked at. And all of them have shown benefits in terms of the comorbidities of MS, like fatigue and mood, behavior, and things like that. So they all seem to have positive influences on MS and appear to be safe when studied in a formal fashion. That being said, even though these diets are being researched, many of them do require you make very restrictive adjustments to your food and your consumption behaviors. And to be honest with everyone here, there is no one definitive diet that has been shown to halt the progression of MS, though many of these diets continue to be studied as potentially an adjunctive therapy for MS. So this is taken from the National MS Society's guidelines for people with MS, and this is what I talk about with my patients in clinic. When they ask what they should be eating, well, in general, one of the things that we talk about is preparing food at home as much as you possibly can, not eating out, the fast food way of life, trying to avoid those types of things, and actually recognizing what you put into your food as you make it. Incorporating fresh fruits and vegetables. We've learned this from the adult world and also from the pediatric world that fresh fruits and vegetables appear to be very important for overall health in living with MS. Selecting lean proteins and healthy fats and staying away from the very, very fatty, high saturated fat foods as much as you can. If you eat grains, choosing whole grains instead of refined ones. Flavor your food with herbs and spices, and then avoiding the processed foods and the foods with added sugar as much as possible. Moving on to physical activity, so kind of linked with diet and linked with weight. We know that kids with MS are less physically active than kids who don't have MS. The thing is that this is multifactorial likely, right? So kids with MS have more fatigue. Kids with MS potentially are higher risk for depression or sleep issues. And so all of those things can cause you to not want to be as active as before. But I think something that I want to hopefully give everyone today is that they're outside of the fact that physical activity is beneficial on weight and energy levels, there are potential benefits of being physically active with having MS. There's at least one study suggesting that kids who have higher levels of strenuous physical activity have a lower likelihood of having relapses and also lower MS lesion sizes over time. In general, I think it was an old wives' tale when I started as a neurologist that physical activity could be detrimental for people living with MS, and that has not been shown to be true. In fact, we know that being physically active is not only safe for somebody with MS, but also can have good gains and benefits in young people living with MS. And so, but one thing to keep in mind that may have been mentioned on past talks is that physical activity should not make MS worse, but you may get recurrence of old symptoms when you overheat. And one of the ways that you can overheat is through physical activity. You can also overheat by having a fever or by taking a hot shower. And so, for some people who live with MS, they may experience a mild recurrence of old neurological symptoms that they had when they first had onset of MS. So, for example, somebody with optic neuritis of one of their eyes may get blurry vision when they take a hot shower or when they're really physically active. But when they cool down, that should go away and get better. So being physically active may cause some of those symptoms to occur. What I tell my patients is that's not dangerous to them. It may be uncomfortable, and if that's uncomfortable, then they should let themselves cool down. But that should not preclude them from being physically active. We know also that kids with MS have lower endurance than kids who don't have MS. We've done a study here at our institution looking at something called the 6 minute walk, which is a measure of physical endurance. And in that 6 minute walk, we have kids walk as fast and as far as they can in 6 minutes, and we time them and we measure their steps as they walk it. We've had this done in healthy non-MS teenagers, and we've looked at teens with MS. And you can see in the figure that they're all stipulated by their body size because that can affect how fast and how far you walk. But we've got the healthy weights in blue, overweight in pink, and obese in green. And what you can see from this just by looking at it is that the MS patients don't walk as far and fast in general compared to the non-MS patients, the controls. What you can also see from this figure is that when you look at the controls, regardless of how heavy they walk pretty fast at that first minute, so the very beginning of the curve. They slow down in minutes 2, 3, 4, but then they speed up when they know they've only got 1 or 2 minutes left. And at the very last minute, they walk faster than they did in that very first minute. We don't see that behavior in the MS patients. The pediatric MS patients walk the fastest in that first minute. They slow down just like the controls do, but at that last minute or two, when they speed up, they never actually surpass how fast they were walking in that first minute. So that's a marker of impaired endurance. And so kids with MS may not have as much endurance as kids who don't have MS. And that in and of itself may impact their ability to maintain strenuous or moderately vigorous physical activity levels. We've also looked at continuous step counts, so measuring how they walk and how much they walk whenever they're not in a clinical study. So we had them wear accelerometers for a week, and we count their step counts. And what we know is that kids with MS spent less time in moderate and vigorous physical activity in a week compared to kids without MS. But I think the key is from this study is that kids who didn't have MS still were not as active as they should be, even though they didn't have MS. So in general, we've learned from these types of studies is that kids who don't have MS aren't as active as they should be, and kids who do have MS are even less active than kids without MS. So nobody's getting as much activity as they should. We recently polled a cohort of our pediatric MS patients to kind of get an idea of how they perceive their physical activity levels. And the majority of our pediatric MS patients report, so 63%, that they're not as active as they want to be. The interesting thing about this is we thought that the majority of these kids would actually consider MS the reason for why they weren't as physically active. But in fact, the vast majority of these kids who aren't as physically active don't think MS is to blame for why they're not as active as they could be. When we looked at parent perceptions and kids' perceptions about how many times per week pediatric MS patients play or exercise hard enough to sweat or breathe, at least for 20 minutes, if not longer, per week. And you can see that the parent perceptions are in orange, the MS patients' perceptions are in blue. And you can see the parents and kids are pretty consistent. They line up pretty well in general. But what we see here is that there is distinctly a cohort of kids who never sweat breathe that hard for even once in a week. In general, maybe most of our patients do 1 to 2 times or 3 to 4 times a week, but the vast majority are not doing at least 7 times a week. And so what we know also is that when we think about youth who don't have MS, so just general adolescents, only 26% of American adolescents are meeting the current recommended activity levels. And 15% who are not being physically active for at least an hour, 15% of youth reported not being physically active for at least an hour on a single day in the previous week. And what we know from these studies over time in youth across America is that these physical activity levels have decreased over time. So a lot of my patients will ask me, well, what should I be doing? How active should I be? And here's what the American Academy of Pediatrics recommends. Most people listening to this are probably going to be between the ages of 6 and 17 years of age. And the recommended activity amount is at least 60 minutes per day of moderate or vigorous activity. And so if we go to the next slide, what we look at is what is moderate and vigorous activity? So if you are doing moderate activity, as you can see in the middle of this here, some physical symptoms that you should be experiencing include some difficulty talking when you're active, feeling warm, maybe some light sweating, maybe slightly short of breath. These could be activities like yard work, jogging or fast walking, tag with friends, or maybe even the movement portion of ball sports like baseball and running to a base or things like that. For vigorous activity, you can't really talk because you're so out of breath. You're short of breath. Your face is red. You're sweating. This is manual labor. This is running the mile in PE. This is skipping rope. This is skiing. This is skating. And that's an idea of what vigorous activity is. So between those two, you should be doing some kind of activity that leads to those types of symptoms or those examples of activities for at least 60 minutes per day. Bottom line is the majority of American youth with or without MS are not getting those activities in, and we need to be. So in general, when we talk about recommending things for physical activity levels, I think the first step is that as a teen or a youth living with MS, and as a parent potentially or caregiver of somebody who has pediatric MS, is recognizing first and foremost the benefits of physical activity on your overall health and on chronic diseases like multiple sclerosis. And then, engage your family in this conversation. So if you're a parent listening to this, I always tell parents it's not only do as I say, but in this situation, it's do as I do. So being an example for your kids, being physically active, and then they can exercise with you or they can mimic your behavior. Children who grow up in families who have active parents are more likely to be active themselves. Working with your doctor, that could be primary care doctor, that could be a neurologist, to identify any barriers or obstacles that are preventing you from being active and talk about them with your doctor and brainstorm ideas about how you can get around those obstacles. Identify what resources you have. That could be gym membership, a family gym membership. Maybe it's structured activities or team sports through your school or your church. Maybe it's school gym class that you have. Maybe it's a community center that's free, right? And thinking about what areas you could have. One of your obstacles may be that you don't have any of these things. You live in a place where there is nothing there. You don't have a ride. You can't get out. Well, what do you have? You may have a sidewalk outside or a backyard where you can run, you can walk, you can set goals for yourself in terms of getting your breath up, doing those types of things. Don't require any equipment. But then ultimately set goals for activity, have your neurologist, have your primary care doctor involved with this, have your parents first and foremost involved in this. But remember to start small and then build up. Don't create an unmanageable goal, unrealistic, that you're going to set for yourself and then fail at it. Start small and then gradually build yourself up so that you are making progress and you can see that as the patient. There's a lot of research that still needs to be done. We need to learn more about the role of physical activity and how it can help reduce disease progression in MS. We need to figure out what kind of interventions we can do and we can give to you as the patient in clinic to take home and do. And what's the feasibility of doing this through the clinic? And also how to engage our patients in these types of interventions. So to kind of recap this whole talk, vitamin D, remember, if you listen to nothing else, then listen to these next two slides. Vitamin D supplementation is safe and possibly beneficial, so talk to your neurologist about it. Smoking, we know it causes a negative effect on MS, so youth who have MS should not smoke, should never smoke. And if they live with anybody or share a space with anybody who does smoke, that's a great time for them to quit smoking to benefit the health of the person living with MS. We know that there's no evidence currently to support a single diet for MS, but you should be incorporating fresh fruits and vegetables daily into your diet. And if you choose to eat grains, choose whole grains over refined grains and avoid processed foods and added sugars as much as you can. Physical activity, as we just finished talking about, set goals for yourself and your family, discuss them in clinic with your neurologist or your primary care doctor, and then maintain that social connectedness, working with your family, your cousins, your friends, that can also help to keep you honest and connected with those physical activity goals. And then finally, I wanted to touch base on this because in my mind, this is kind of the holy grail of where we can ultimately get a pediatric MS patient is the idea of wellness. And being well does not mean that you don't have disease. You can live well and have MS. Wellness is an active process where people become aware of and they make choices toward a more successful existence. So this is something a concept I try to teach my teens is taking primary responsibility for your health, for your MS, but also for every other aspect of your health, like your diet and your physical activity levels. Being proactive in applying the concepts you learn today or the concepts we teach you in clinic and using that self-directed approach to improve your health overall. That may be including behaviors that focus on your diet, exercise, maintaining a healthy weight, being emotionally well, and then avoiding high risk behaviors like smoking and marijuana use. So, in summary, I think hopefully you take away from this that the comprehensive care of a young person living with MS is far beyond just selecting a disease modifying therapy. That's a very important aspect of treatment, but there are so many other aspects of care beyond that that we need to be thinking about. This care includes the management of pain, fatigue, mood disorders, cognitive issues, psychosocial functioning, and family support. And again, the MS Society is here to support families and patients for this, as should be your local, your primary neurologist. Environmental factors may also serve as modifiers of disease, like vitamin D and smoking. And then we also have talked a lot about how we can influence our weight, how we can eat healthy, and also how we can promote physical activity. But ultimately, again, the holy grail of living with MS is promoting wellness. So the young person taking advantage of this, being proactive, and recognizing all of these different aspects that they could potentially focus on to improve their overall health, in addition to having an adequate disease modifying therapy and working with their neurologist to live well while living with MS. And that is all. Thank you guys so much. There's my references in case you want to review some of the stuff that I presented today.
Well, great. Thank you so much, Dr. Brenton. This has been an excellent presentation. I know I've learned quite a few things about things I could be doing differently and things I want to think about a little bit differently. So from here, I want to review a few pieces of resources that we want to make sure families are aware of before we let you go for the day. So first, if you haven't taken a look at our pediatric resource guide, you can find this on our website. It is a comprehensive flyer of links to pediatric resources, and we're happy to share that with you at any time so that you can find everything that you're looking for specific to pediatric MS. It includes additional organizations that support youth and teens with MS and their families. On our website, you can also find financial resources for families impacted by pediatric MS, as well as links to Walk MS and other activities, which are a great opportunity for that connection and support that you can get in person in your local community. And if there's ever a time when you have questions or need additional support, you can contact an MS Navigator. The Society's MS Navigators are very skilled, kind professionals who are supportive people that can help you work through the challenges and changes with MS based on your personal experience. They might be able to provide emotional support resources, MS healthcare specialist referrals, support working through health insurance options, benefits, and employment resources, accessible and affordable housing possibilities, and a lot more. They really can help you figure out what you need and how to talk to the right people to get it. You can talk to an MS Navigator over email, by direct message on our website, or you can call 1-800 344 4867 to learn more. They can help both parents and kids and give you helpful resources for your whole family. If you're a kid and you want to talk to an MS Navigator, do make sure that it's okay with your parent or guardian before you do so. And if you want other connection opportunities specific to the pediatric MS community, I would encourage you to check out two of our groups that are dedicated to connection for these groups. The first being our MS Youngsters group. They meet virtually on a monthly basis, and they also have an Instagram presence at MS Youngsters. You can follow them there. We also have a Parents of Children and Young Adults with MS group that meets virtually the last Sunday of each month at 7 p.m. Eastern. Again, please visit our website for more information about both of those groups and how you can get connected to them. Thank you again, Dr. Brenton. We really appreciated you being here today, and thanks to everyone who joined us. We hope you learned something new. Please don't hesitate to reach out anytime with questions.